and I think that's a key point here. We've been interested a lot in research about how much people move, the metrics of running distances, running speed, volumes, weekly distances, and so on, and not much about what I call that the macroscopic exposure to running and to speed. But we have not been so deep into what I call the microscopic strain or the microscopic exposure. So let's say that we are two football players and we move the same amount of meters per second in the week, in the month. How does our biomechanics, our sprint pattern influence our overall injury exposure?
Welcome to FSI Talks, where football experts from around the world share practical and updated knowledge with the FSI community.
Hi, football friends. Welcome to FSI Talk, where the best experts in the world come together to talk about football. My name is JB Morin. I'm a full professor at the University of Saint-Etienne in France, and I'm very happy to be the host of this talk. And today we are going to talk about sprinting and biomechanics and hamstring injuries. And I'm very, very happy to invite here my guest today, Chris Bramah. Chris is a researcher in biomechanics, a clinical physiotherapist at the University of Salford, Manchester. And I'm very happy to have Chris on board today because I feel like on this topic, we're hearing many, many times the same people, the same voices. And I feel it's good to have fresh voices, not only because they are fresh voices, but because they have interesting ideas to share. So thanks for that, Chris. And can you just introduce yourself?
Yeah, thank you very much for the invite, JB. It's a real honor to be on here with yourself talking about sprint mechanics. Obviously, you've been a leader in this field for a long time, so it's a pleasure to be chatting alongside you. And so for those people who don't know me, I'm a physio by background. I work at the Manchester Institute of Health and Performance, where I still deliver clinical practice, including rehab and biomechanics, and at the University of Salford, where I'm a lecturer and a researcher, with my research focusing on, I guess, the clinical application of biomechanics. And in particular, this is an area that I've been long interested in.
Great. So I would say let's start with why. Why do you think it's important, and why have you started studying sprint mechanics with football players in particular?
Yeah, well, to be honest, the why comes from both personal and professional experiences. So as a youngster, my background, actually, what people won't know is I grew up as a sprinter, training for 200s, 400s, with a lot of Olympic level athletes who had been away and trained and been coached under people like Dan Paff, who had a lot of a mechanical influence to the way their training was delivered. So that came back to the work that I was doing at a club level, where we had huge mechanical influences on our performance. So before I even started studying, I was personally really intrigued by the way we move. And then from a professional perspective, as I sort of grew clinically working with athletes with different injuries, I started to get a lot more consultancy work from football players and football clubs of all different levels. And growing up in track and field, there was this automatic sort of insight for me where I started to look at the way people move and think, actually, hang on a minute, in team-based sports, we don't seem to be prioritizing movement in the way that we do in track and field. And that led to me being a bit more intrigued as to whether or not that was perhaps contributing to a lot of injuries that people are having. And then my recent research was really sparked by working with some colleagues at a football club over here in the UK, where they approached me and asked if I would help them develop ways that they could screen movement patterns in field, as they, also had a track and field background. So had this thought process that movement was influencing the way their players were getting injured.
Yeah, so thank you. And I think that's a key point here. We've been interested a lot in research about how much people move, the metrics of running distances, running speed, volumes, weekly distances, and so on. And not much about what I call that the macroscopic exposure to running and to speed. But we have not been so deep into what I call the microscopic strain or the microscopic exposure. So let's say that we are two football players and we move the same amount of meters per second in the week, in the month. How does our biomechanics, our sprint pattern influence our overall injury exposure?
Yeah, so it's a really good question. And I think in terms of looking at mechanics and the links to injury, I feel like I'm probably stealing one of your quotes here when I say that sprinting is both the cause and the cure of hamstring strain injuries. And I guess what we mean by that is, from a cause perspective, we know that sprint running is where the majority of injuries occur, largely due to the muscle strains and the stresses that are impacted on the tissue as we run. But it also forms part of the cure in that if we can manage the way we expose people to sprint running, as well as the performance of sprint-based running and the movement qualities that people adopt, we can perhaps take more of a holistic approach to reducing injury rates and maybe make athletes a bit more prepared to deal with the demands of sprint-based running. Classically, what we've all done, and as clinicians in the past, I've been guilty of going there, is we've all directed our focus towards gym-based interventions, which are one aspect of it, but often neglect this whole thing of as you say, the microscopic strain that's being applied to the tissue as we move. And mechanics are that thing that influences that microscopic strain. And if we think of the whole body as this like interconnected links, the movement patterns that occur at different segments are therefore going to influence the length changes of the muscle tissue. But not only that, is if we move in certain ways, we will change the force demands on the whole body and in particular the hamstring tissues themselves. So that will then influence the stress and the strain that's applied to the tissue. So mechanics really are one of these key elements for for basically managing the strain that's applied. And what we found in some of our work is, one, we can screen mechanics in field, and two, that using simple screening based mechanisms, so we use like the SMAS score, which people will have likely come across, using that as a screening method, we found that there's a direct association between suboptimal movement patterns and future injury development amongst professional footballers. So mechanics then can form part of this holistic assessment. And for me, it's also a holistic sprint-based assessment. So looking at things like someone's exposure to sprint-based running, how much they are exposed or underexposed, looking at their performance, so actually how much force can they create as an individual, and then looking at their movement quality, so like how well do they move overall. And all of these features for me really interact to influence one another. So, I've obviously just mentioned about how movement quality influences the applied strain, but exposure will also influence how much I am prepared, or how well I am prepared to deal with that applied strain. So if I have someone who's really underexposed and then they move badly, we really ramp up their exposure, they might be more vulnerable than another person. So I think, looking at mechanics and movement quality is this holistic sprint-based assessment, which moves us solely away from just developing physical qualities in the gym and gives us a bit more, hopefully, a balance to how we manage injuries.
And I guess you will agree with me that we can summarize that very simply by saying that if we are two football players with exactly the same status on every known risk factor so far, previous injury, age, volume, and all that stuff, and we differ significantly in our running pattern and in our sprint pattern, then very likely we don't have the same amount of strain when we run, and thus not the same amount of risk. And I thank you for sharing some unpublished results, if I understood well, that you've collected. You agree with that?
Yeah, they're definitely unpublished results. So yeah, hopefully they will be published. But yeah, completely agree. And I think that is a really key point, is that if we look at the literature on exposure as well, there's some really nice work done from an author called Malone and Tim Gabbett, which showed that sudden increases in sprint running exposure led to injury development. I think for those people, it was around on average about 75 to 100 meter week-to-week increase. But that's based on a population norm. Now, mechanics are going to obviously influence the strain per stride. So for people with poor mechanics, actually, it might be that even less of an increase in training load can lead to injury development, because that strain per stride just becomes massive when added up over several loading cycles.
And that relates to one of your previous studies on running, like, regular, low pace running. And I often say to my students that even 1 degree of difference per step can be, at the end of your season, an overload that is massive to your tissues, and that is tilting the adaptation balance. So yeah, definitely. Very little can have very big influence. So yes, now it's time to go to the how-to. How can we assess that, let's say, in a field slash clinical way? Because obviously, almost nobody listening will benefit from 3D motion capture. You and I know that. It's very time consuming and difficult. How can we do to have a rough idea and to get to know better the players?
Yeah, well, from a field-based perspective, I think we can get lots of information on very regular occasions to help us sort of profile injury risk amongst athletes. Because within the same data capture, you can not only force velocity profile your athletes, but you can also then capture their movement quality by using our recent tool, the Sprint Mechanics Assessment Score. So, and this I think is really easy to integrate into environments, because basically, for these testing procedures, you just need to set up a 35 to 40 meter max effort sprint for people. To use an S-mass, you'd basically position a 2D camera just outside, so you're capturing them once they're in a max velocity position. And for your force velocity profiling, we can either position radar guns at the start, or so we're monitoring that way. Or if we didn't have a radar gun, just getting a series of timing gates lined up. So putting that as a nice setup, you can capture both force velocity profiling and movement quality in one go. Now, the S-mass ourselves is a 12-item qualitative screening tool, which is really simple to use because it just rates athletes against different criteria for either having it or not having it. And the more criteria they have, the more points they get. The more points they get, the theoretically more worse their movement patterns are. And it takes us on average about 2 to 3 minutes to assess. And one of the big things that we found when we've gone into clubs and done this is at the beginning of requesting people to engage in the process of letting us test athletes, there's often been hesitation and reluctance that, oh, maybe this is going to take us a lot of time to do with our athletes. Can we really fit this in? But we've always made it so the timing gates, everything is set up. So once they've finished their normal warm up, they can effectively one by one just sprint through, walk back and sprint through again. So total testing procedures for a squad of 25 to 30 takes us no more than 15 minutes. And it's forming part of that warm-up prep that they can then go on the pitch and engage in the rest of the session. And actually, most coaches have turned around and gone, hey, actually, we quite liked the way that was so easy to do, that we'd be willing to do it again.
Yeah, the real processing time is for the clinicians, for the practitioners, for you and I. It's not for the players, because very often people complain about time-consuming processes where it's not actually players' time processing consuming. You see what I mean? Yeah, on that point, so your score is about 12 items, and it's all of them are related directly or indirectly to the strain in the hamstrings. Can you just tell us what are the typical variables that you point to? And the $1,000,000 question, if you had only one variable, like the biggest rock, you're not forced to answer that, but what would be your go-to if you had only one variable?
Yeah, okay. Well, so the score itself, I generally break it up into 3 main subcomponents of the score. And those subcomponents include features of lumbar pelvic control, backside running mechanics, and overstride running mechanics. Now, for me, lumbar pelvic control is perhaps the array of features, or the combination of features that we are most widely accepting of as having a strong association to hamstring injury development. And that comes from, we've got multiple mechanistic studies that have been done using cadavers and using modeling studies. So some of Yoda Mendeguchia's work has been fantastic at showing how changes in pelvic position can lead to changes in strain on the biceps femoris. Similarly, Elizabeth Trumanoff has shown that altered movement patterns, or I guess certain muscles that span across the pelvis and trunk, can basically reduce strain on the hamstring tissue. So those features for me are, I guess, those that are more strongly associated with injury development, and we do have prospective studies that link them to injury. So I always consider them first of all. Backside mechanics and overstride, perhaps less associated in the literature with injury, but from an anecdotal perspective, I really quite like the consideration of backside mechanics as one, because I think having limbs functioning behind the center of mass for the majority of the gait cycle has consequential effects for how the pelvis moves, and therefore how the hamstring of the lead leg becomes strained. And also is one of those that I feel like, if we correct that, it can have many beneficial effects to lumbar pelvic control as well. So I guess, that's like a longish answer to the things that I look for. If there was a number one thing that I would care about, and one mechanical variable, is a really tough one, but I'm going to say the one that's perhaps got its strongest association as an individual parameter is anterior pelvic tilt. The difficulty is how reliable we are as only assessing that one feature in field, I think becomes more challenging.
Yeah. My take on this one, because that's a question I was asked a couple of weeks ago by a physiotherapist. Like, it's always the same when you have a composite score and people track you down to what's the number one. And I said, no, that's the score. That's the aim of a score. But if you want to get into it, I was very interested in the effect of trunk lean, because in my opinion, trunk lean can also be related to the 2 points you've just said, backside mechanics, because very often when people have a forward inclined trunk, and that's very often in football, they have a backside type of mechanics that comes with it. And there was this Japanese study showing that when you ask people to, on purpose run with an inclined trunk, they also show an anterior pelvic tilt, because very often these two points are related. But it kind of makes sense most of the time that some players have a kind of consistent, score in that.
Yeah, I think that question is difficult, because one of the reasons I went down the route of creating a composite score anyway was because I used to get almost a little bit frustrated with when certain practitioners I'd work with would overly fixate on whether or not they can observe this millimeter change in a particular position. And I felt like the reliability in that often was so poor and took us away from this holistic picture. Whereas a composite score reflects the fact that trunk lean can influence anterior pelvic tilt and can be driven by backside mechanics. And all of these features just interact with one another to influence the overall stress on the tissue.
So great. We've done a study a couple of years ago that showed that when players, actually football players, fatigue, be it a session type of fatigue, a game type of fatigue, repeated sprints, or I would say a seasonal type of fatigue and so on, they have different changes in the mechanics. That is no consistent, which was very surprising. We think that everyone will shift the same. It's not the case. And so my question here is, how would you structure this kind of monitoring over a typical football season? Because as we know, just a single time point pre-season doesn't deliver a lot in terms of, actionable data.
Yeah, I think that's a really key point. Because we've done loads of things over years where we even look at just physical qualities at single time points, and often they have no relation to future injury development. So yeah, you are hit the nail on the head with single time point assessments are often useless, basically. Now, with our SMAS tool, we did do just a single time point, and we only followed up for like a short period, a 6-month period with people. And we did find that that was still associated with future injury development. But what we know from the literature is when we look at other parameters as well, like exposure, or we look at force velocity profiling, these things like vary and they fluctuate week to week, dependent on a player's fatigue, dependent on what else has happened to them that level of the week. And only when we monitor them close to the event are we sensitive enough to potentially predict those people who are going to get injured. So that then as the question of when would we fit this in? Well, I think there's a combination between ideal blue sky thinking and pragmatism for people. If I was to go blue sky thinking, for me, profiling sprint mechanics would be a weekly basis, and that should just be set up and form part of their warm up. Because not only then am I able to profile force velocity profiling or horizontal force output and see if I'm getting any decreases that might increase their susceptibility to future injury development. I can then see their change in mechanics, if they're improving, or if actually somebody's, as a result of fatigue, now aren't controlling the kinematics as well, so it got worse. But at the same time, I'm microdosing exposure to sprint-based running, which is hopefully developing those tissue qualities. So weekly would be my ideal work. And I think you were actually on a recent paper that did it in track and field, and small study in track and field that showed weekly profiling predicted future injury, right?
Yeah, and we did also that was published in a congress last summer, and we did also a constant monitoring of the sprinters and hurdlers in France. So that's not football, but with the GPS, including competitions. And I would say that for these metrics, as soon as someone sprints, then you can get them. And for the kinematics, you need to set something, and sometimes in the clubs, you need to generate a specific type of test atmosphere, and that might be the tricky discussion with the staff. But as you said, if it's part of the last step of a warm-up, it's only external measurement. So you just have to make speed happen at some point, and you have the external measurements to quantify.
Yeah. I think one of the main things that we've found on other projects when we're trying to implement like regular in-season testing is that changes in schedule, etc., can often act as like barriers to that weekly type implementation. So I guess as like a minimum, really, I'm quite keen on the idea that even if we viewed it as a quarterly type thing, so like every 2 months or even every month, we could integrate some form of testing, I think would be ideal. But yeah, so that's where I think the pragmatism then comes in, is knowing that if we have to screen things routine, where can we plan to try and deliver that?
Yeah, definitely. In your experience, so the main point is that here we have a diagnosis, and we have a kind of a regular monitoring diagnosis, which is in my opinion one objective. Now let's talk about intervention. Can we try and, let's say, I wouldn't say fix, but can we try and modify things so we tend to have a better gait overall? That would be in turn a better gait on the pitch.
Yeah, so this is a question that I always get asked, and throughout my entire research career, people have targeted me with this one, like whether it's endurance runners or sprint-based runners. And I don't really know why this gets so much backlash, and people like to think that you can't change movement. Time and time again, we've proven across research studies and in practice that you can optimize movement without negatively impacting people's performance. Now, years ago, we did it with endurance runners and found that were injured, and found that actually in a very short space of time, you got them up and running. And from a sprint-based perspective, Jurgen and yourself have like led the way in this area and have shown that well-planned interventions that target a combination of physical, structural contributors and movement can lead to positive changes in kinematics and improvements in performance that are associated with decreasing the strain on the hamstring tissue. From an anecdotal perspective as well, time and time again, I'll work with different athletes and make changes almost acutely. So I've had really nice cases where over the years, I like to experiment a little bit. So I'd have people come in that demonstrate certain mechanical features around lumbar pelvic control. And I nowadays, I won't even tell them what I see. I'll just start to deliver some form of drill-based and mobility-based intervention, couple of little cues as they run, and see if I can make them change that way. Yeah. And effectively, we can. So we've got a research base that's showing that well-planned interventions, drills, simple cues such as increasing step frequency, can lead to positive changes in someone's mechanics without compromising performance. So
yeah, I tend to answer exactly the same when I'm asked. I say basically, and I'm trying to be a bit provocative. I say if you don't trust that you can change a gait in someone, or you can change a sport movement, whatever it is, like a basketball shot, tennis serve, whatever, then change jobs, because that's the aim of training, the aim of technical interventions. So if the human body, the neuromuscular system, was not able to adapt in any case to anything, then we will not be trainable. So it kind of makes sense here. The question is not if, the question is how can we change?
Yeah.
And very often the people who are not really okay with knowing how question if, the big question now is, yes, we know we can have changes in an acute, time scale after specific coaching, like increase your stride frequency or shorten your contact time, straighten up your trunk. Many, football players can do that. I mean, on demand. The big question is, do they maintain that when there is no coach anymore, no cue anymore, and they are left free to their own movement?
Yeah, well, so there's my personal opinion on this. And part of my PhD 8 years ago now was like looking at whether or not we could change endurance runners, first of all. And what we found with those people is even within, we basically gave an acute intervention where we cued them to change, followed them up at 4 weeks and at 3 months. And even at 4 weeks, they were all retaining the new movement pattern. And so we were changing them at 4 weeks. And at 3 months, there was a bit of variability. So some people could still execute the new movement pattern really well. Other people were starting to revert back to their old way. But effectively, what that's saying to me is that there is the capacity to make long-term change very easily and quickly. But if we don't reinforce it regularly through promoting and trying to optimize good movement patterns in warm-up based interventions, that we run the risk that people would start to get back into bad habits.
Yeah.
So yes, I believe, and I think we're seeing that it can be retained, but I think the key thing here is that movement should also be part of people's training. It's like we're very happy with keeping strength as part of our training. We should also keep movement as part of our training.
I agree with that. Like, piano drills and or anything that is part of, it's cultural, that strength or mobility is part of the, training routine. Doesn't make sense not to do it. We should have this type of movement as a part of it. Yes, I agree with that. Last question. Do you have any experience to share? Of course, there's no specific research on that, on a very specific population that's elite athletes, elite players, high level, top league players in this gait retraining environment?
Yeah, so I've had quite a few different experiences of working with professional footballers where we've tried to make mechanical changes. Now, look, most of the time when I see people at that particular level, it's usually because they've got a chronic injury history, and therefore people are asking like, okay, we need to approach things a little bit different. But there've been multiple occasions where we've had recurrent soleus-based injuries and recurrent hamstring strain injuries, where we've made acute changes to their movement patterns and changed the way that they move straight away. They've then gone on, and the clubs have come back a year later and been really thankful of the work that's been put in, because they've gone, okay, well, actually we've taken this person from a re-injury case and chronic re-injuries to successfully performing and not having another hamstring injury. So we've had several cases where we've done that. And then if I go back to track and field based work, I've had other instances where I've had elite level, like Olympic, European standard athletes come in with certain mechanical faults. I've made immediate cues, and I remember one particular case was an 800-meter runner. They came in with a load of chronic injury issues. We changed their movement pattern almost there and then, and they went on later that year and they medaled at the European Championships. I made a joke to my wife at the time, and it was just nothing more than a joke, and I was just like, oh yeah, that's my cues, that's my movement cues. And only 2 weeks later they did this news article in their national media come out and about the changes that they've made to the movement and how they felt like that was like a positive influence on the rest of their season. And then after that athlete spent the rest of the entire year sending me videos of the way that they'd run and asking for like more cues at each event, which I thought was just hilarious. But all of these cases show that changing movement can lead to positive outcomes, especially if you've got somebody who's, that recurrent injury case where mechanics are a clear driver.
Yeah, Yeah, I agree with that. Okay, Chris. So very last point. What's coming next? What is your current research topic? Anything you can disclose?
Yeah, so I've definitely got some interesting projects in the pipeline that have been going on for a while. Hopefully, we've got the study looking at the sprint mechanics assessment score and hamstring injuries coming out in the near future. And then there's also some projects that we're sort of working on to, I guess, try and enhance that element of the project, but also some side spin-off projects that have been a bit interesting to me, looking at physical qualities and movement patterns that athletes adopt to try and, I guess, inform potential more specific gym-based interventions targeted towards movement.
Yeah.
So that I don't want to give too much away on those type of
No,
things.
that's great. That's great. I understand it's a very dynamic topic, and how can people best follow your next publications?
Yeah,
Next.
so I tend to be fairly active on social media platforms like X and Instagram. So my handle is at Chris Bramah. And at the same time, ResearchGate is regularly updated there if people want to see new articles. But I try to make an effort to disseminate the research findings out and make as many of our papers open access as possible for people to access on social media.
Excellent. So you will definitely be welcome for a FSI talk in the future, for sure. Thank you all for listening, and see you in the next episode. Bye-bye.